When I interview women, I really hear hormone deficiencies. Sometimes it gets quite emotional with women, especially. They're like, I just want to feel good. I want to be there for my family. I want to have energy. I want to play with my kids.
And they go to their doctors or primary care physicians and they do labs on them because there's something not feeling right on them. And they all look normal. Your labs look normal. Well, then why do I feel not good or not like myself? And it's frustrating. We're kind of gaslit a little bit. Like, this is just part of life. This is just part of getting old. And I truly do not believe that anymore. Welcome to Look Good, Feel Good with Matt and Amy McKinley, the podcast where we bring you expert advice and honest, real talk on health, wellness, and feeling your absolute best. From hormone optimization to aesthetics and everything in between, we're here to help you live your best life. Let's dive in. Welcome back to Look Good and Feel Good with Matt and Amy. I'm Amy.
Howdy, I'm Matt.
So today we're going to discuss a topic that's kind of near and dear to my heart, and that is women's hormones. And, honestly, we are way often overlooked and underserved because when it comes to hormone replacement therapy, women aren't being treated correctly or even treated at all.
Yeah, and they're not only just underdiagnosed, but sometimes misdiagnosed. We hear all the time that a woman will see a provider and talk about their symptoms with brain fog, hot flashes, low energy, low libido, and they're just kind of dismissed.
Yeah, and women are often told, like through perimenopause and menopause to just tough out their symptoms. And perimenopause can last sometimes up to, sometimes 10 years. And we're just told to this is just how it is. And, we're not supposed to suffer. There's no reason why we need to suffer. And, we're meant to feel good, strong, supported. And our hormones, basically play a huge role in that. And so, when we don't optimize, we miss out on protection of heart disease, bone loss. A lot of times that's what happens when we go through menopause. Bone loss is part of that. Mood disorders. There's so much that happens to us women as we go through menopause.
Cardiovascular disease.
Yeah. And
that's a huge one.
And there's no reason why that needs to happen. Like I said before, we're all going to die. That's just inevitable. But there's no reason why we need to suffer by optimizing our hormones and replacing that. And when I say that, these are not scary. They're not dangerous. They're bioidentical hormones, what we already make. So why does it make sense? Why are providers scared of hormones when we have bioidentical hormones that we make? It doesn't make sense to me.
Yeah, conventional treatment has not been good for women, and us along with others out there now trying to remedy that by getting women treated, not for the things only that we mentioned. All of those things that Amy has talked about actually make you feel bad, feel not good as far from a health standpoint. One thing I would love to touch on is when I interview women and men, but I will ask them, tell me what your best life looks like, and now tell me what you would like to fix with that. So as we go through that process, I really hear hormone deficiencies. Really, that's a big thing.
Yeah.
Sometimes it gets quite emotional with women, especially. They're like, I just want to feel good. I want to be there for my family. I want to have energy. I want to play with my kids. I want to go do things that make me happy. And I just don't feel like it anymore. And I don't sleep good.
It's true. They say these things and they go to their doctors or primary care physicians and they do labs on them because there's something not feeling right on them. And they all look normal. Your labs look normal. Well, then why do I feel not good or not like myself? And it's frustrating. I think that's something that's been very frustrating for us women. We're kind of gaslit a little bit. Like, this is just part of life. This is just part of getting old. And I truly do not believe that anymore. Estradiol is a hormone us women start to lose as we go through menopause. And menopause, like I said earlier, is diagnosed with an FSH over 50, which is follicle stimulating hormone, which our pituitary gland tells our ovaries, hey, make more estradiol or don't make estradiol. When we're young, we're making plenty of estradiol. And so those FSH levels stay low. But as we get older and we don't make as much estradiol, that FSH starts to go up. So it's really 1 year without a period. That's diagnosing of menopause. So estradiol levels go down. And estradiol is very protective of bones, also cardiovascular, keeping protection of our cardiovascular, also brain. Our brains love estradiol. We have tons of estradiol receptors in our brain. And so that is so important to replace as we get older and we lose it. And we're not doing that as providers. And I feel like there needs to be a movement to help women become optimized and feel good and replace those estradiol levels and progesterone levels and help us feel better.
Amy mentioned 3 primary things: osteoporosis prevention or fracture prevention, brain health. There was a study that came out over a year ago that showed women treated with estradiol when they hit menopause have an 80% decreased risk of developing Alzheimer's or early onset dementia. But what I'm going to talk about is cardiovascular health. So cardiovascular disease or heart disease is now the #1 killer of women and men.
Yeah.
Women, congratulations, you've caught us now with heart disease. The importance of estradiol in regulating cholesterol levels, which buildup of bad cholesterol in our arteries, is a major cause of heart disease, and it's a killer. It's a silent killer. We don't feel it until it kills us or in a bad event, adverse event happens. So the importance of estradiol, and put it clearly, estradiol, in our opinions, should be taken orally because it gives heart protection. If it's not taken orally, it does not give heart protection.
And I think that is true. So there's different ways to give estradiol. There's creams, there's injections, there's oral. And there's some really good study and some really good data out there to support that oral estradiol. When we take something orally, it goes through the liver to be broken down. And there's some conversion with the HDLs that help to reverse plaque development in our arteries. Whereas more of the topical estradiol, which a lot of people do, topical estradiol or creams, there is still a cardiovascular protection, but it doesn't reverse the plaque, whereas it keeps plaque stable in the arteries. This is what the studies show, but it doesn't actually reverse it, where oral estradiol actually reverses the plaque in the arteries.
Yeah, and so when we say oral, we mean taken through your mouth as a capsule.
Yeah, like a tablet. It's a tablet.
Tablet, excuse me. I don't take it, but I've seen it.
The tablet. So anyway, but that is the difference between how you take it too. So oral estradiol, even some of the studies show that oral estradiol is better than some of the bisphosphonates out there, which are some of these
quality.
Yeah, there are medications that we use for osteoporosis or osteopenia that starts to happen as we get older. It shows better quality of bone with oral estradiol treatments. So there's so much benefit to estradiol, and we're not good at replacing it because there's this scare thing that estradiol causes heart attacks or blood clots, breast cancer. That's the thought process out there. I don't know the myth out there, but it does not. Estradiol does not cause breast cancer. In fact, if
it did, all women in their prime would have breast cancer.
Especially when we're producing a lot of estradiol in our younger years. Estradiol has been proven not to, with breast cancer, doesn't cause breast cancer. In fact, the studies show that if you take estradiol, you have the same risk of developing breast cancer on or off estradiol.
However, if you're taking estradiol and you do get breast cancer, you have a 50% increased likelihood of surviving breast cancer.
Yeah, so it protects you. There's a good protection to it too.
One thing I will point out about estradiol, if a patient has a history of blood clots from other reasons, that is probably the one time we would prescribe creams.
Yeah, even though we know estradiol does not cause blood clots.
Yes, but we would be critiqued by our colleagues
to prescribe estradiol.
Yes.
So it's just one of those things where we know it doesn't. However, when we talk about estradiol versus, like I talked a little earlier about, pharmaceutical industry cannot patent what we make bioidentical. So they've had to come up with something a little different. I call them estrogens just because it's an easier way to say it, but estrogens being more of a synthetic estradiol. They found that pregnant horses, mares, they actually, in their urine, have estradiol in it, and they were able to take that and make a medication out of it. And it's called Premarin, which stands for pregnant mare urine.
Yeah.
I didn't know that anyway, but there's a little bit of estradiol in it. But there's estrone, which is more inflammatory, and there's some other metabolites that our body doesn't need. However, it's not bioidentical.
That's why estradiol, and remember that word, estradiol, that is what you want to take. None of those synthetic hormones. You want the bioidentical hormone.
Same thing with progesterone. Let's talk about progesterone. It's another hormone. Women make a lot of it, especially during our pregnancies. We make a lot of progesterone, and it's a hormone that makes us feel good. It helps us sleep better. It helps with anxiety. It helps protect us against endometrial cancer. There's just so many benefits to progesterone. It does not cause blood clots, and that's another thing that we need to talk about. The pharmaceutical industry cannot patent progesterone, what we make. So they've had to come up with something a little different called progestins, which are in birth controls, and the Mirena IUD. It's in some of our medications. However, it's not the same thing. It's not the same thing as progesterone. And
micronized progesterone, that's what you want to take. It's ultra filtered, so it's a very high quality impurity. Amy mentioned, I'll just tell you from experience what I get in feedback. Women that don't sleep well, women that have hot flashes, women that have anxiety, we put them on progesterone and they sleep better. They sleep through the night. They're not sweating and throwing off their covers and yelling at their husbands all the time, even though we don't deserve it, by the way. But it also gives a calming effect. And that's been well documented with studies. Well, in fact, I had a husband and wife come in a few weeks ago and we were reviewing labs. And the wife says, hey, I've been doing really good, but I've been thinking about going off this program. The husband he looked at her and he said, no, you're not. And she goes, what do you mean? He goes, you are not going off of it because you were like this. And if you're not watching this, I'm giving a nice steady state hand. He said, you're like this now, and you used to be up and down all over the place. So that calming effect is a really big thing too. It just makes women, we call it a feel-good hormone for women, just makes them feel better, not only at night, but during the day as well.
Yeah. So progesterone is very important, and it starts to go down as we get a little older too. So optimizing your progesterone levels is important too. Something else that, we don't want to forget about is thyroid. And we talked a little bit about it in a little earlier episode about thyroid. But as we get older, our thyroid levels start to we start to decrease. And, we're not talking about TSH. We're talking more of how you feel. We're talking about T3 levels, pretty much the active part of thyroid that is used in the mitochondria for energy and metabolism. I also use it a lot in some patients that come in that are insulin resistant, that struggle.
Huge for insulin resistance and weight gain and women that can't lose weight.
We optimize their thyroid. And I tell them all the time, listen, I'm not treating you for hypothyroidism. I'm not treating you for hyperthyroidism. It's more like what we call euthyroid, EU thyroid. It's just not probably working the best for you. And so optimizing that thyroid for you, a lot of women feel better on thyroid, even though they don't have thyroid disease. And so that's something I think that's important to listen to your patients, listen to their symptoms, maybe sometimes trying it. And, their levels will go out of a range, but that's not a bad thing.
And from a basic scientific standpoint, thyroid stimulating hormone is a hormone that the brain sends a signal to the thyroid to make thyroid. So as thyroid stimulating hormone starts to go up, which means we're getting more stimulation, oftentimes at that point, we're making less T3. Okay. So what we want to do is optimize the T3 and T4, but not just T4. I don't want to get too complicated, but T4 has to convert into T3. So with the hormone we use, which is NP thyroid, which is natural pork thyroid, or Armour thyroid, all of the thyroid is already broken down. It's not converting into anything else. It's already converted. So what it does, it will hit your receptor sites and bind to your receptor sites and make it usable for the body. So oftentimes, even if levels look okay on a lab, they're not working well because they're not binding to receptor sites appropriately.
Yeah. And sometimes that you just can't see them on, labs, but that's why some people feel better on it. And that's just why we say, if you feel better, then that's what we're after, is how the patient feels, not what the labs show.
A lot of times we'll hear, I went to my doctor, he said my thyroid's normal. Okay.
Yeah.
Well, what's normal for you may not be normal for someone else. It may look normal on this lab that has a range, okay? But what we want to do is optimize those levels. So many, especially women, okay, will come in just so frustrated because they have all the symptoms of low thyroid, getting cold all the time, temperature regulation difficulties, cold hands, cold feet, brain fog, and nothing's been done about it because their labs are in a normal range. So as Amy mentioned, oftentimes what we'll do, we'll start a low level of thyroid and see how they feel. Oftentimes it's literally the missing link.
Yeah.
And someone feeling great.
And it's true. And a lot of times I'll start them at a low level and we'll kind of increase it and just see, and we'll increase it a little bit, kind of seeing how they feel. And, if we find their levels, we'll stick at it. It's just one of those things, is listening to your patients and listening to how they're feeling. And that's why I think I'm so passionate about women's health. I just feel like it has been overlooked for so many years. I think when the Women's Health Initiative came out, it really destroyed a lot of women's life. It was a very poor study about hormones. And literally, I think they have blood on their hands, literally, because thousands of women came off, hundreds of thousands of women came off their hormones, which was not the optimal hormones. It wasn't bioidentical. However, there were some benefits to it too. But how many women were scared of hormones after that? And now that lasting effect. And makes me very angry that we've been mistreated for so many years. And I feel like there is a kind of a movement coming, with lots of new information coming out, podcasts and social media. And I feel like there is a movement coming to, get the word out there that these aren't dangerous, that women need to be on replacement therapy for the quality of life. And there's no reason why women have to die from broken hips and wrists and back. I just feel like that's just should not happen. And replacement of hormone and optimizing is, where it's at.
Our goal for you is to really educate you, or at least get you thinking about it.
Yeah.
Think about it, research it for yourself. Don't just trust us, but advocate for yourself. Okay. No one else will. No one cares about your health more than you do. Maybe your family. But if you don't do it for yourself or help others, no one else will. So our goal is to help you look and feel your best for the short and long term. Again, I say this probably on every podcast, but quality time remaining, QTR. That's what life is all about. Quality time, not just time.
We appreciate you joining us today on our Look Good, Feel Good with Matt and Amy. And if you know someone that needs to hear this, or, have any questions, please reach out to us and ask us.
Or even just share the podcast to those that you think might benefit.
So thank you.